The immune system works by keeping track of all things found in the body. But when a new substance enters that the immune system doesn't recognise, it becomes all-out war. The immune system responds with the ultimate form of defence: attack.
T cells are the cells that help you fight infection, and particularly viral infections, but they also have a role in preventing cancer cells developing.
What's so special about CAR T-cell therapy in treating blood cancers is that it uses a person's own immune cells to destroy the cancer cells.
It's very personalised, so you design the therapy using the patient's own immune system, number one. You design the therapy to recognise a protein on the surface of their cancer, number two, and so you get less off-target effects. Chemotherapy goes everywhere and attacks normal tissues, whereas CAR T-cell therapy is very precisely targeted towards the proteins on the surface of the malignant cell, and therefore it avoids hitting the normal tissues.
The process involves removing the T cells, which are a type of white blood cell, separating and altering them, and then infusing them back into the patient. The amazing part is that CAR T cells then start to increase in number, which help destroy more cancer cells.
The CAR T-cell therapy is a living drug, so it expands up to 10,000-fold in the patient's own body.
Where other treatments for blood cancers have failed, CAR T-cell therapy offers new hope. It's a one-off approach that can prevent relapse.
I was diagnosed with marginal zone lymphoma. That was back in 2020. I couldn't believe the diagnosis because at the time I was likely the fittest and healthiest I'd ever been in my life. I had chemotherapy and radiation, and got complete remission, which was fantastic. Although it relapsed and came back. And when it came back as a more aggressive lymphoma called large B-cell lymphoma.
Triathlete Matt Turner was rocked by the news of a relapse. But less than 9 months after CAR T-cell treatment, the father of 3 is in complete remission and back in training.
It's a great relief that I was able to receive this CAR T therapy and survive.
So patients who are eligible for CAR T-cell therapy have gone through multiple other treatments and therefore have limited treatment options available to them. Now with CAR T-cell therapy, more than half the patients stay in remission for long periods of time. We're trying to improve on those results to ensure that the patients who go through this treatment can continue to enjoy long-lasting remissions.
Peter McCallum is the only site in the country that manufactures CAR T-cell therapy. And with the new gene and cell facility that opened last year, production is up 400%. But not all CAR T-cell therapies are government funded. Patients need to meet certain criteria to be able to get it for free.
So blood cancers in total account for about 10% of all cancers. And then the subtypes that we are currently treating are relatively uncommon. So pediatric and young adult acute lymphoblastic leukemia is relatively uncommon. And multiple myeloma, which is one of the more common cancers, which we're waiting for CAR T-cell therapy to be approved for, affects about 2,000 patients in Australia every year.
This living drug therapy has revolutionised how aggressive blood cancers are treated, with the hope that it will do the same for other types of cancers in the future.
The centre gives us the opportunity to bring the best ideas from Australian academic investigators, but also biotech industry, to develop those ideas into treatments that can go into early phase trials for patients to see whether they actually deliver the promise of being able to control the diseases the patients have.
It enables me to appreciate what I have more, knowing what I've been through and being thankful for what I have.
To see this work come to fruition where it's actually changing people's lives, in particularly patients who have no other treatment options, it's really gratifying and exciting to be part of that story.